Good evening, everyone. Today we'll discuss all the 20 plus 2 planes. Already I talked to spine, head, thorax, all 20 planes, abdomen, pelvis, limbs, face, overview 2, and the exclusion that if there are 50 anomaly can be rolled out with these methods. Okay, first we'll talk about the plane 1. Okay, here you can see this is where you look in this plane 1 is your sagittal spine, is your sagittal spine. This is where you look at the ossifications of the spine. Okay, you need to assess the that the skin is totally covering the spine. In normal case you can see how the skin is totally covering the spine. Okay, there is no defect at all. Okay, there will be the ossification center. You can see there is very well ossification centers is there, very well ossified, and you have intact skin covering the spine. In normal case, this is the first plane 1 is the normal case. In the abnormal case, you can see in the abnormal image there is a big cystic spaces, big cystic area. You can see this is the big cystic area, and the skin covering is not in continuity. It is there will be a defect. You can see there will be a defect. Okay, there is a big cystic area and missing ossifications. You can see there will be no ossification center also, the missing ossification centers of the spine. So there is a probably this is a neurative defect. This is the plane 1, this is the sagittal spine. This is the spine is the first plane number 1. In the spine, again this is the sagittal section of the spine. You can see in the sagittal section you can see the skin covering and the ossification center of the vertebral body. If there will be a defect in the spine covering, then it is there will be, you can see this is the cystic area, and there will be a missing ossification center. That will be abnormal. There is a possibility of neurative defects. The second plane in the spine, that is your coronal spine. In the normal image you can see the ribs and the spine. The ribs and the spine, you can see this is the ribs and these are the spine, which will gradually taper at the end, that is tapering of the end toward the sacrum and comes together. The abnormal fetus, you can see the second image how this is the normal, that is the ribs gradually tapering the spinal end, is the spinal end is toward the sacrum, is gradually tapering will be there. But in the abnormal image there will be a splaying of this image, that is defective of plane 2 is abnormal, the splaying of the spine, that suggests you also some defect in the spinal curves. You can see this is the image, the abnormal appearance of the frontal bossing of the frontal bone. This is the Lehmann sign, this abnormality, and you can the splaying of the spinal cord at the lower end of the sacrum. You can see this is the cystic area, and you can see the genesis of Barmiel genesis, that is Arnold cherry malformations. You can see the cerebellum, it is like banana shaped. Okay. In the next is the plane 4 to 6. In the head you can see that the various abnormality all over hollow frozen cephali, banana shaped cerebellum, cystic hygroma, large posterior fossa cyst, lemon shaped skull, occipital encephaloceles, skin edema, ventriculomegaly. The next is the key features of plane 4, that is your transventricular plane. You can in the transventricular plane basically you have to measure the head circumference of the biparietal diameters at the transventricular plane, that is the plane 4 or transthalamic plane. The plane in the normal view you should be able to see the shape of the skulls. It should be oblongs or the shape of egg or the shape of egg or V with regular control. It is important to see all the suture in the skull, because it ruled out certain abnormalities such as your craniosynostosis, because if you don't get any suture line, there will be almost a few suture line, then it is called craniosynostosis, and there will be a midline falx cerebri, and there will be a cavum septum pellucidum. That is the rectangular anechoic cavum located at 1/3 distance from the front of the head. This tells you the direction is anterior. In the you can see the lateral ventricle. You can see that the coronal fluxus almost touches both sides of the lateral ventricles, both medial and lateral. This is how it should be. The measurement of the arteria of the lateral ventricle should be less than 10 mm. That is the cutoff of the limit for the lateral ventriculomegaly. Anterior horn of the ventricle should be visualized. Thalami of the area between the two ventricles, third ventricle has to be visualized. You can see this is the plane number 4, that is the transventricular plane. In the transventricular plane you can see the suture line. If you don't get any suture line, that means it is a craniosynostosis. And you should have see the both side of thalami, and you can see the anterior horn and falx cerebri. This is the falx cerebri, this is the anterior, both side of anterior horn. You can see this cavum, septum, pellucidity. This is a rectangular structures in the more towards anterior. This is the CSP is more towards the anterior, cavum, septum, pellucidity, and this is the third ventricles. This you can see the view both between the thalami. You can get the third ventricle. You can see this is the lateral ventricles. As for the ISUOG in the plane 5, that is the transthalamic plane, the ISUOG guidelines suggest using the transthalamic plane, you have to measure the head circumference and the biparietal diameter. In the plane 5, what are the structure you should identify before going to measure the head circumference and the biparietal diameter? This is the 5 has to be there. First is your midline fact has to be there. The cavum, septum, pellucidity has to be visualized. The thalami, both sides is visualized, and the hippocampal gyrus and the lateral sulcus. These are the points. Has to be the 5 structure has to be visualized before you have to measure head circumference and the BPD. So this is the case. This is the midline. This is the transthalamic plane. This is the midline falx cerebri, and this is your rectangular structure. Is the cavum, septum, pellucidity has the second structures, and the lateral sulcus. You can see this is the lateral sulcus has to be visualized. Then this is the hippocampal gyrus has to be visualized. Hippocampal gyrus. And this is your both side thalamus, and this is the third lateral ventricles. Okay, this is the hippocampal gyrus. In the plane 6, there is the transcerebellar normal view. In the normal view, what are the structure you have to see? You should able to identify the following structures, like the almost similar, just small changes. That is the here cerebellar, you get a cerebellum instead. The midline falx will be there, the cavum, septum, pellucidity will be there, the thalamic has to visualize, the dumbbell shaped cerebellum. It is very important to note the shape of the cerebellum, and the knuckle fold has to be added here. So extra things if the cerebellum is added compared to the transthalamic plane. In the transthalamic plane, you see this is the lateral sulcus and hippocampal gyrus is added, but in the almost similar structure, midline falx, cavum, thalami, along with that, you have to add the cerebellum, dumbbell shaped cerebellum, and your knuckle fold thickness. You can see this is the image of transcerebellar plane. This is the both side. Thalami has been visualized. You can see this is the thalami, this is the thalami, and this is your falx cerebri. This is the falx, this is the cavum, septum, pellucidity. Okay. Then you can see this is the cerebellum, this side, this is the vermis. Okay. This is the behind the cerebellum. You can this is the cystic spaces. That is your cisterna magna, and this is your knuckle fold thickness. So these are the structure has to be visualized in the transcerebellum. So look at the checklist. You have a checklist. Tick up the one of you can spot. You can find one of them. Go back and find where it is. The first is midline falx, cavum, septum, pellucidity. The shape of the skull has to be measured. The C suture of the skull has to be determined to see craniosynostosis. Cavum, septum, pellucidity. Shape of the skull has to be the midline falx is there. Lateral ventricle, anterior horn, thalamus. This is the abnormal appearance of the plane 4 and 5. I told the image so a cases. This is the case. There will be no skull bone. There will be absence of scalvarium. There is a case of anencephaly. This should very apparent assumed will not able to generate plane 4 5. This is the anencephaly of 20 weeks pregnancy women. In the second image, you can see there will be this is the ventricle. The ventricle size is more than 10 mm. That is a more than 10 mm. This is the biparietal diameter head circumference measured in the transthalamic plane. The ventriculomegaly, the carotid fluxus is not touching the medial border of. In this image, you can see that how ventriculomegaly is seen. There is several things to note about this. In this image, you can see the carotid fluxus. This is the carotid fluxus is not touching the medial border. This is the medial border of the ventricles. It is not touching the medial border of the ventricles. And you can see this is the lemon skull. This is the frontal busing of the frontal bone. This is a lemon skull. This is ventriculomegaly with lemon shaped skull. This is the head is lemon shaped. The carotid flexus is not touching the medial border. It appears to be separated or dangling. Carotid flexus. This most probably it is due to open spina bifida as you have the lemon sign and the ventriculomegaly. You can compare this two normals versus abnormal image. The plane 4 is the normal image. Compare the two images below. In the normal image plane 4, you can see the head is normally it is a like rugby ball. You can see the how the rugby ball egg shaped. It is totally egg shaped, the shape of the skull. In the abnormal image, you can see the shape of the skull. It is like there will be frontal busing. This is a lemon shaped skull. How nicely it is visualized. Okay. In the abnormal, you can see the lemon shaped of the head and the ventriculomegaly. Also, you can see this is the ventriculomegaly. It's more than 10 mm. You can see the coral flexus is touching the medial border. You can see the coral flexus is not touching the medial border of the key to recognize that shape of the head is look different and the ventricle looks abnormal. So there will be a probably there will be underlying abnormality, that is a neural tube dip. There will be a ventriculomegaly with an open spina bifida. And the second, the plane 6 abnormality, you can see that this is a normal plane. This is a cerebellum. Already I told this is the thalami. This is the hippocampal gyrus. This is the falx cerebri, the cavus die. This is the 2 cerebellum with the burmix with the sternum magna. This is the knuckle fold thickness. In the normal image, the 2 images below, notice the difference in the shape of the cerebellum. You can see the shape of the cerebellum, how it is. It is a like dumbbell shaped. It is the dumbbell shaped cerebellum. Here it is a banana shaped cerebellum. You can see how this dumbbell shaped cerebellum, this is a dumbbell shaped dumbbell, and this is your banana shaped cerebellum. In the normal image, the cerebellum is dumbbell shaped, and in the abnormal image, it is a banana. The key is to recognize that there is abnormality here. We have a banana sign. There is also a brachiae in the ossification center and the overlying skin of the spine. Okay, cover the next sections.